In this short video, I will describe the procedure of radical cystectomy and pelvic lymph node dissection. This means that patients will have their bladder removed, the prostate removed, and the lymph nodes surrounding the bladder and prostate. Many patients ask why the prostate has to be removed. The answer is that in up to 25% of patients, the cancer has actually invaded into the prostate, and it's very difficult for doctors to determine this before proceeding with the procedure. Therefore, for the best chance for cure of your cancer, these organs are standardly removed. Your surgeon will discuss whether an open procedure done through an incision underneath the belly button or a robotic-assisted surgery done through ports placed in the abdomen is the right procedure for you. For the open approach, a relatively small incision underneath the belly button extending down to the pubic bone is made. The abdominal cavity is entered and the ureters, which are the tubes from the kidneys to the bladder, are identified and detached just above the bladder. A space between the prostate and the rectum is created, and the blood supply to the bladder secured to reduce bleeding. Finally, the prostate is removed off of the pubic bone. The urethra is divided and the bladder and prostate removed. Once this has been performed, the lymph nodes, which are small glands responsible for processing inflammatory cells and cancer cells, will be removed. The lymph nodes lie on top of the blood vessels known as the iliacs. The removal of the lymph nodes tells us whether the cancer has spread beyond the bladder, and it is important to direct any additional therapy as well as for the possibility of cure. Once the bladder and other organs have been removed, a urinary reconstruction must be performed, which will be discussed in a later video.